Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine here. Welcome to our video series for parents. Please remember these videos are not intended to replace visits to your physician's office. If you have ongoing questions, we're happy to see you here in our office at area code 775-359-7111. Please remember, we really can't answer your questions over the phone or the internet. That's really just not good medical care and not something we're in a position to be able to do, because we want to provide only the best possible care for your child. So if you'd like to be seen, we can get you in the same day. Please give us a call. Today, as we continue our ongoing series looking at first aid issues, especially summer first aid issues for children, we'd like to talk about poison oak, poison ivy. Now, depending on where you live, this may be something that you run across a ton. Here in northern Nevada, where I live, there's really not a whole lot of poison oak, poison ivy. There's some poison oak up in the mountains, but not a whole lot. Where I grew up in the mountains of Southern California, in the San Gabriel Mountains, loaded with poison oak, year-round. And what the stuff looked like kind of changed depending on the season. The leaves would fall off in the fall, making it very difficult because all you had were the stems. That's really outside of the discussion here. Talk to a local park ranger, talk to the local Boy Scout troops. They know what the stuff looks like. They can educate you. But what do you do if you actually get wrapped up in the stuff? Well, the first thing to understand is that the reaction that you're getting is really a contact allergy. In medical terms, what we would call a type 4 delayed type hypersensitivity. It's a sort of allergy, but not particularly responsive to antihistamines like Claritin, Zyrtec, Benadryl, because it's not driven by the chemical histamine for the vast majority of this. It is to the oil, the allergy or the reaction is to the oil that is in the plant, the leaf, the stem, the roots. So the first thing to do is to wash the oil off the skin. Get out of the clothes that may be exposed and wash those. Get that oil off the clothing as well. If your dog has been rolling in the stuff, wash your dog. Get the oil off of the animal's fur, because you'll spread it around the house and then you'll continue to spread it across yourself. Topical hydrocortisone helps to take the itch out and helps to make the rash fade quicker. Ice, if it's miserable, can help with some of the discomfort. Calamine lotion can help as well. If things are severe, if your eyes are swelling shut because you got it on your face, see your doctor. He can give you some more potent steroids than hydrocortisone, or even put you on oral steroids if need be. Now, instead of having a skin allergy, if what you have is a true type 1 allergy, you can actually have severe anaphylaxis through this. Drop of blood pressure, difficulty breathing, wheezing, swelling of the mouth, the tongue, the airway. If that's happening, if you have an EpiPen available, use it. Go to the emergency room immediately. Call 911 if you're within cell phone range. That's a cause to be evacuated from your wilderness area emergently. And it's outside of this discussion. So what we're really talking about is the rash that's so typical and so common. The rash that's so typical of poison oak and poison ivy really is similar to the rash that some people get with nickel-containing earrings or from the buttons on their pants. When people tell you they have a nickel allergy, this is really what we're dealing with. And just this reaction tends to be more severe and more sudden in its onset. And because of its severity, some medication helps. If you're miserable, though, see your doctor. There are things we can do to help you. First, though, please remember, get the stuff off your skin so you're not spreading it. If you have it under your fingernails, get the oil out from under your fingernails so you're not scratching your face spreading it now to both sides of your face, scratching your other arm and spreading it onto your arm. Good luck this summer. If we can be of assistance here, if you think you've gotten into some poison oak, give us a call at area code 775-359-7111. One last idea, kind of in the modern world. If you're not sure what you've gotten into, if you see the plant, take a picture of it if you have your phone with you. That'll help us to identify exactly what it is you got into and have a better idea of what's going on. We'll see you next time.